Let me start by welcoming everyone. Welcome to our panelists. Welcome to our audience. Thank you for being here. My name is Jonas von Hoffmann. I'm a research fellow at the GIGA, and I will be the moderator for today's forum on From Reform to Reality, Germany's Cannabis Policy in International Perspective. Right now is a highly opportune moment to talk about Germany's cannabis reform. Last week, we witnessed an escalation in the criticism of Germany's cannabis reform from last year. The Ministry of Health called it poorly crafted. The Minister of the Interior used more colorful language and called it a shit law. Last month, we had the first partial evaluation that was published. This evaluation came to less alarmist and less extreme conclusions, and I quote, "The results available so far do not indicate any urgent need for action." What are we to make of these different assessments? What has happened with and might happen to Germany's partial legalization? And how does Germany's cannabis regulation and its initial results compare and contrast to what has happened elsewhere? Over the last decade and a half, we have witnessed an increasing number of countries allowing legal access to cannabis, and understanding and learning from these growing experiments and experiences with legal cannabis might help to not only put into comparative perspective, but to assess what is occurring or has not yet occurred in Germany. I'm delighted that we have an expert panel of participants with us who work on issues of legal cannabis and cannabis regulation. We have Professor Rosario Queirolo from the Universidad Católica in Uruguay, Dr. Simon Howell from the University of Cape Town in South Africa, Dr. Elle Wadsworth from the University of Bath in the United Kingdom, and also here from Hamburg, Jakob Manthey, who works at the Zentrum für Interdisciplinäre Suchtforschung at the University of Hamburg, and who has been involved with the aforementioned evaluation. Let me just say a couple of words about the format and the structure of the forum and of what is to come. After these introductory and housekeeping remarks, we will speak first in a roundtable format about the design and implementation of cannabis regulation in South Africa, in Uruguay, Canada, and of course in Germany. And that then will be followed in the second part by Q&A from the audience. So please put your questions in the Q&A section. I will collect them from there and then put them to the panelists. Without further ado, let's get to it. So first of all, and for an audience that might not be necessarily following that closely cannabis regulation around the world, to get everyone up to speed in a few words, what has happened in Canada and Uruguay and South Africa and Germany? How can cannabis be produced, distributed, sold in some cases, but not in others, and consumed? Let's start with Uruguay because it was the first country to legally regulate cannabis on the national level. To you, Rosario.
Okay, thanks, Jonas and GIGA for organizing this event. It's a pleasure to be here. And well, briefly, Uruguay, as Jonas said, was the first country to regulate the whole market of cannabis. And it did that in a very particular way. We have very restricted regulation, very state-oriented regulation, in which users that are over 18 years old can access legal cannabis through three ways. One is home growing, The second one is social cannabis clubs, and the third one is through pharmacies in which cannabis is sold. This cannabis that is sold at pharmacies is produced by a group of licensed company, and the cannabis that is sold there in a way is kind of fixed by the government in terms of the THC level that is allowed, that the varieties that are allowed, and also the packaging and everything. Only flowers are allowed to be sold, no edibles, no tinctures, no oils. And also the regulation is very restricted in terms of the quantity that of the amount of cannabis that a user can access. It's the maximum amount per month is 40 grams. And also maybe the most particular thing of the cannabis regulation in Uruguay is that each user, in order to be legal, has to be registered in a register that is mandatory for each of the three ways. I think that this is like a general idea in order to give time to the rest of the people.
Thanks a lot. And Elle, we might go to you. How in Canada we see a lot more kind of both variation, because there's not one model, but there are many models in the different provinces and regions, but also stronger role for private kind of interests and activities. So can you give us a quick rundown of what has happened in Canada with legal cannabis?
Of course. Yeah, so similar to Uruguay, so Canada was the second country to legalize at the national level. And like you just alluded to, there's laws at the federal level as well as at the provincial and territorial level, and also at the municipality level. So Canada legalized cannabis in 2 phases. So in 2018, they legalized dried flower, and you were able to access dried flower from 2018. And then from December 2019, other products entered the market. So unlike Uruguay, there are other products that are available beyond dried flower. So the Canadian government categorized these into edibles, topicals, and extracts. But within those categories, we've got edibles, we've got drinks, we've got solid concentrates, tinctures, topical sprays, vape oils, you name it. There's everything there, but the restrictions tend to come in the THC. Or the strengths of it. So edibles, we have limits on what can be put in packages, so up to 10 milligrams. But the restrictions come with the possession limits. So in Canada, it's up to 30 grams of dried flower, or the equivalent in non-flower weight. Like you said, again, with the provincial laws, the provinces and territories determine the laws at the retail level. So it looks very different across those 13 jurisdictions. So we've got 10 provinces and 3 territories, and you can access cannabis with home grow, with physical retail stores, this is brick and mortar, or online stores. And the physical and online stores could be public run, so the government run, or private, or a hybrid of the two. So that's where you see the differences across the country. So some provinces have a fully publicly run system. So the stores online and physical are run by the government. Some provinces are fully private. So this physical and online stores are privately run. And then other provinces have that hybrid of the two. So like you mentioned, Jonas, it's very mixed in that respect. Which makes it interesting to look at because you've got 13 different markets.
Yeah, thanks a lot. And also, and here we come to Simon. I think what is interesting is this is not just anymore something that's limited to the Americas, whether in North America or then in Uruguay, and South America, obviously in the United States, but we also have experiences and experiments going on in other parts of the world, including in Africa. But in South Africa, we don't have this kind of as comprehensive of legislation, and also the process has been slightly different with an important role for the courts. Simon, what has happened in South Africa?
Thank you. So I think, I mean, the key difference in South Africa is that cannabis, essentially decriminalization for private purposes, has come out of the result of strategic litigation in the courts by specific interest parties. So, you know, it's not so much a grassroots movement or anything, but rather the result of a long-term litigation and various court orders that have taken place in the country. And as a result, you know, I mean, South Africa has both simultaneously somehow managed to go quite far and yet move nowhere at the same time. It's a very South African thing to do. And that is, you know, there is space now where we have allowed for the possibility of decriminalization and yet somehow have not managed to actually codify this in any significant way. So for instance, at the moment, private adult use amongst consenting adults is legal, but that can only occur in private spaces. What a private space is remains somewhat undefined, but I think, you know, the law conceptualizes it as a house, which is useful. But when you have large areas of informal settlements, you know, the concept of a house and the concept of defined borders and the like becomes a bit more fluid. There's that issue. There's also the concern around, you know, the act that we have at the moment, which is called the Cannabis for Private Purposes Act, which essentially tries to promulgate this, has been assented but hasn't yet commenced in government's language, which means that while legally cannabis has to be decriminalized, procedurally and operationally in terms of the police, it hasn't been. And as a result, there's quite a mess. And I can't really think of any other way of defining it, that, you know, while we have one set of rules and one set of laws, but they are completely enacted in completely different ways. And as a result, there's a lot of mess and there's a lot of misunderstanding. And at the moment, I think the key part of government and the key emphasis on government is trying to figure out how exactly to regulate cannabis in the context of South Africa, which, you know, presents unique challenges considering just how complex a society it is.
Thank you. And again, I think this is a common thread in many countries that have regulated, that the decision in a way is easier than the implementation, and often the filling kind of the law on the books with life is slightly more complicated. And we have also seen that in Germany. Jakob, briefly, maybe for some of, if there's a more international crowd, what is Germany's famous partial legalization? What does it entail?
Thanks. I was just thinking, Rosario mentioned Uruguay being the first country, Canada being the second country. Germany is obviously not the third country to legalize cannabis, but I think maybe it's the largest by population technically that has legalized cannabis. At least some form of supply, and that's where we come in with the term partial legalization that was not actually introduced by researchers, but by the government, by the German government, by the previous government. Because it allows private and collective cultivation in certain limits, 3 plants of private cultivation and cannabis clubs in size of up to 500 members. And then there is no option to really go into commercial retail. So any kind of shops that will, or actually mass produce, and then, or an industry that will mass produce and then sell cannabis for recreational purposes is not allowed here. Instead, we have quite a thriving medical market because parallel to the partial legalization of non-recreational cannabis, non-medical cannabis, we have also seen a liberalization of the medical cannabis law, shifting medical cannabis from a narcotic to a non-narcotic substance and making it much easier to prescribe it for medical purposes. And now I think Germany has one of the most liberal laws when it comes to medical cannabis globally, because you can basically get cannabis on prescription for nearly every illness, for every ailment. Even anti-aging has been discussed as one of a disease that you can get it prescribed for, making it basically available to everyone. And it's very, very accessible if you want it, even with home delivery. So that's a very thriving market. whereas the recreational part, the non-medical part, is difficult to assess. But we'll, I guess, come to this later.
Yeah, that's what I would want to get us to, but let us stay for a bit with the kind of design and more implementation. We've already touched a bit about it, but thinking about what are the kind of main strengths and weaknesses, and based on your research, your analysis of the way that cannabis is in some form legally available in each of the countries, would you say are of the regulatory model, if we can call it that? Maybe we'll start with Elle in Canada.
Yes, that's fine. Thank you. So I think what I'll probably illustrate more is those 13 different markets and the strengths and weaknesses that we can see, I guess, across the models there. Because like I mentioned before, they can look very different, and I'll illustrate by taking Quebec as an example. So Quebec is so I think it's the second most popular province in Canada towards the east of the country, and it's got a fully government-run market, so that you can get it from physical stores as well as online, and it's run by the government, so it's fully public. What makes Quebec different from all the other provinces is that it also puts a THC limit of 30% across all products. No other province or territory does this. This doesn't make too much difference with regards to dried flower, because it naturally tops out at around 30% anyway, but it does make quite a difference with other products that can go up to maybe 70, 80, 90% THC. Quebec also don't allow edibles that are attractive to youth, and they have, I believe they've now allowed them onto the market, but initially they didn't allow vape oils. So it's a very different market in Quebec than it is everywhere else. And you can contrast that with, say, Alberta, a province towards the west of the country, which is fully private. They don't have THC limits. They allow all products. It's fully private. So there's many stores and don't know what the end of my sentence was there, but you can contrast to a more public health focused regulatory model versus one that's more commercialized, maybe more private. And you can see the differences there. I can go into what was found with that, so you can see the strengths and weaknesses, but I don't want to take too much time out. So I think it's just highlighting that you can see, at least in Canada, how different models and regulatory issues are presented under one federal umbrella. Yeah, I'll pause there.
Which in itself, it's kind of interesting, right? Because Germany is also a federal state, but we don't have that kind of inbuilt policy experimentation, even though there was this idea of having local experiments with then commercial supply, which also seems to not go ahead.
And I think we're seeing that in Switzerland as well, with their local experiments as well, that you could see how different things roll out.
Maybe Rosario, how do you see the uniqueness and strengths and weaknesses of Uruguay? Also, kind of being an early adopter, there might have been some things that were done differently than, say, in countries that had the chance to see what happened and how Uruguay implemented cannabis legalization.
Well, I think that in the case of Uruguay, the regulation had three main objectives. One was decriminalization of users. The second one was public health, and the second one was undermining the illegal market, and in a way undermining the drugs security and violence relationship. And I think that the regulation, in a way, was very strict in defining all those characteristics that I mentioned earlier regarding the register, the maximums of THC, And in that sense, it was clearly a regulation that was good in terms of public health. But on the opposite side, the same regulations are an obstacle for undermining the illegal market. So I think in the Uruguayan case, it's very clear. It's very easy to see like this kind of balance that you have to have. No, if you really need to undermine the illegal market, and you put a lot of strict regulations, like in the case of Uruguay, the illegal market will remain. And in a way, it's something that is what is happening in Uruguay. On the other side, it's good in terms of the public health, because you don't have many of the problems that in another jurisdictions occur. For example, there are almost non-intoxications of childs for using of cannabis, because there are no cookies, no brownies, no nothing. So it's in a way you are saying, okay, the regulation is good for this, but it's not good for really move all the users to the legal market. So I think that the way in which this experience has been evolving is clearly showing that no, you cannot really do both things at the same time, and you have to decide for which one you are more prone to.
Thank you. And Simon, you mentioned the mess and the kind of messiness. Is there any kind of redeeming feature of this, of maybe the legal ambiguity as well, and not having these more strict rules and regulations that are maybe more clearly enforced?
Well, I think on the one hand, I mean, the key strength of the South African version or system is that it's a rights-based framework. So, you know, I mean, it's grounded within the ideas or the ideals of human rights. And, you know, as a result, that both simplifies the argument, but also makes it a lot more difficult to implement. So, you know, it's not the debates about what should be included or, you know, how much THC, those are very much secondary to the idea that, you know, people have a right in their private places to consume cannabis. Now, of course, there's also within South Africa, there is this sort of dissonance between, yes, they have decriminalized the use of cannabis in private settings, but there's always been a large population of people consuming cannabis anyway, irrespective of the laws. And I mean, you must remember that in South Africa, cannabis grows literally like a weed. I mean, you don't need any special production facility to grow cannabis in South Africa. And as a result, you know, I mean, its use is very widespread. So I mean, all this is this is almost a secondary conversation, because frankly, you know, I mean, I've noticed that whether the law says this or that, people continue smoking it either way. But we don't, you know, I mean, the debates then become around medicinal cannabis versus, you know, the path of consumption. Those debates have been a lot more complex and a lot more uncertain. So, you know, we have a difference in regulatory strategy when it comes to medicinal cannabis, which is going to be licensed through what we call SAPA, the South African Health Products Regulatory Association. And that will be separate from typical consumption. Now, in South Africa, for instance, while we're allowed to now smoke cannabis in our private places, you're not allowed to purchase seeds to grow cannabis. So ironically, you know, the fact that you're growing cannabis immediately means you've broken the law in order to do so. But that's kind of overlooked. There's also, you know, I think one of the big weaknesses is that there's a retail market now, but it's not a functioning retail market because of the confusion with the laws. And despite actually being illegal, you know, there's sort of this gray zone where people are now opening up shops and allowing things to be sold, but could equally be closed down by the police any second. So again, you know, the mess is both a sort of a product of South African society, but equally something that continues to undermine it. And I think the lack of regulatory clarity is something that we desperately need, but no one's really ready or brave enough to actually put pen to paper and figure out how that's going to look in our context.
Thank you. And to shift slightly, Jakob, Rosario was talking about the kind of too onerous or too much regulatory burden undermining the ability of regulation to displace the illegal market. If we take that for the Cannabis Association that exists in Germany and that grow cannabis, that could be taken almost straight out of the evaluation report that was written last month. I would say from part of the reading, obviously there's a lot more about it and in there. Can you give us the kind of main take-home points and conclusions that your team came up with after 18 months and with this partial evaluation?
Yep. So first, we only started this year actually in January, so that's very important. And we don't really do a regulatory assessment, so we don't really follow up too closely what the clubs are experiencing and what the barriers, the administrative barriers, and all that is, because this is also not really prescribed in the law, and we're really acting on the provisions of the evaluation that is prescribed into the law. Nevertheless, we observe that there are very few cannabis clubs actually licensed operating. They have produced only little cannabis in 2024, which is mostly due to having very, very few clubs being licensed in that year. It will shift definitely in 2025. There will be more clubs, many more clubs running, operating, distributing cannabis this year. But basically, there are a number of barriers that really bar them from operating, from obtaining a license. There are some very weird variations going on between the regulatory agencies. Some agencies are very, very strict. Some are very supportive. So this means that in some states you hardly have any or none clubs running, and in other clubs you have quite a few, up to 100 clubs running. So this makes it really an interesting starting point for research, because you might be seeing differences in variations in supply, correlating to variations maybe in use or in uptake or displacement of the illegal market. But I want also to connect to Simon's thoughts about regulatory clarity. In Germany, one of the major issues that have been raised by the police is that they don't really know what's going on. They have been so accustomed to persecuting people using cannabis that this is obviously such a major shift to not really do anything about public consumption anymore. Although, in brackets, public consumption is not allowed in certain circumstances, but it is quite a difference. And police claim that the current system with very high amounts of public possession being allowed for users really disallows them to persecute illegal trafficking and illegal sales on the street, or basically dealing. So here comes in not really my perspective, but I think regulatory clarity for the clubs, for users, where and how to smoke and not to smoke, for policemen and for everyone involved is really important, really essential for a law like this that is so fundamentally changing the everyday life of so many people is really essential. And I think there are some parts where the German law might be improvable.
Thank you. And to me, the point you raised is really interesting, because there has always been this idea that clear thresholds would provide more clarity, right? And in Germany, we did not have these thresholds previously. Now we have them, but the argument is kind of they're too high, and that obscures more than it allows. Simon, you were shaking your head.
Well, I mean, we've had a number of problems around thresholds and the like. So I think, I mean, sort of echoing the point around policing is that one of the key issues is that our police are they don't really know where to go or what to do, but are equally remain within a policing framework which has a KPI system, for instance, which requires that they perform a number of drug arrests per station per year, and that's a fundamental part of the KPI system. And as such, it's driving a type of policing which is incredibly damaging, and in contrast to what policing should be about. So we found that our police are targeting specific member groups. So, for instance, Rastafarian groups. Both because they need to make KPI, but because also, I mean, the gray zone is so large that you can still do this. And another issue in South Africa has been around, there's been a discussion around how many plants one could have, for instance, or grow in your private land. How do you implement or operationalize that? For instance, I mean, do you go around and count the plants? What happens if the plant is bigger? Someone's plants are bigger than others. I mean, does that still count as one plant? Or so there's a whole raft of issues around operationalization, which have fundamentally stalled the conversation. And I think for us, and my big concern is that we're getting bogged down on these type of details when we really still need to discuss the conceptual stuff. How do we do this in a manner that's compliant with our constitution and with our legal framework, and that does not create more harm than previously?
If anyone wants to jump in, feel free. Otherwise, I had some more questions on the kind of results and the evaluation, and then also in different contexts, right? One of the big worries has always been that prevalence goes through the roof after any kind of reforms that increase the availability of cannabis or the ease of access. What have we seen in Uruguay? What have we seen in Canada? And we can start with Rosario, maybe.
That was not the case in Uruguay. Prevalence were increasing before the regulation, but after the regulation, actually data shows that the increasing tendency is low, and then became to a point that now is kind of a shallow. No, so in a way, with what we saw was that, and this is all for adolescents and youth, and also for the general population. So what we see was an increase in the people that is around 40 and 50 years old, that has like an experimental use, and then they should say, okay, this is not for me. So the percentage that had a really significant increase was only on that group of people, but not in others. Actually, we run an analysis using a synthetic control comparison, the data from Uruguay and Chile. In Chile, they didn't have a regulation, and before our regulation, we have the prevalence were very similar among Chileans and Uruguayans for monthly use, for the prevalence for the year, and also for life prevalence. And in one country, Uruguay with the regulation, and in the other without the regulation. After we passed the regulation, as I said, our prevalence tends to be shallow, and in Chile, without the regulation, they kept increasing. So in that sense, it seems that the way in which the regulation was carried out in Uruguay really was a huge push for consumption, for increasing consumption. That's not the way in which people see the topic, no? Because if you hear like public opinion think that really cannabis is everywhere, because you can see, because in Uruguay it is allowed to use cannabis in public. So for sure that you can see more cannabis around, and actually smell more cannabis around in the streets, in the bus stop, at the stadium, at the beach, everywhere. but actually the prevalence data doesn't show an increase.
Thank you.
It's a similar non-dramatic story with Canada. So the prevalence before legalization in Canada using data from the government's national survey, so the Canadian Cannabis Survey, was 25% at past year use among people 16 years and older. So that was 25%. There was an increase after legalization, but I think in 1 or 2 years after, so it went up to 27%, but then after that it stabilized. So I think, unless I need to double check, the last survey that they had was still at 27%. So it had a little up, and then it's been stable since then. When we look at youth, this has been relatively stable before and after legalization, but that doesn't mean that it's not a concern. So Canada did a legislative review. So this was they started 3 years after legalization, and their report was out, I believe, in 2024. And one of their areas of concern was still youth use, not because it had increased, but because it was still youth use in Canada is still one of the highest rates in the world. So it's still high, it just hasn't increased. So still of concern, but legalization didn't seem to have changed that. And then I believe as well with daily use, so quite an indicator of problematic use down the line, was also quite stable in Canada. So there wasn't a dramatic change, but that doesn't mean that it's not a concern.
And I mean, not to misattribute anything, or, but I think, and it's in a way still very early days in terms of what has happened in Germany, but this is also something that was in the evaluation, right? That there hasn't been this kind of dramatic increase, and we can say as of yet, but of prevalence in Germany. Jakob, I wanted to ask you what though has changed, and we can just say this is a difference of how it's treated by law and the classification, is the kind of criminalization on the enforcement, right? In parts of, because the threshold have been increased, but there we do see a change, right? In how some of these cannabis offenses are classified and are being dealt with. What are your initial results on that front?
Yeah, first, we do see parallel trends or parallel trajectories with regards to prevalence of use, very similar developments as in Uruguay, as in Canada. So we'll also expect minor increases, but there is a natural limit. We won't get to 50, 60, 80% of prevalence of use. It's not going to happen. I mean, this is pretty sure. So right now we are at 10% among adults. We're at maybe 5, 6, 7% among adolescents, and it's gonna be staying around there, I guess. That's my best guess for the next 5 years. With regards to changes in criminalization, so what we found out and what our conclusion was that this law has actually led to the most pronounced decriminalization of any behavior, of any criminal action ever since 1945. So it is obviously a substantial change in how we deal with the substance and how German public sees and perceives a former deviant behavior that is long been embedded in our culture as something immoral and something that is perceived to be an outsider behavior, an outlaw behavior, and it is now more common than ever. I can only confirm observations of Rosario. You see it more in public, and it is more and more part of our society, also because it is just being used by so many people in our society. So you can't ignore it. And this obviously comes in a situation where nearly half of the population is not in favor of this law. And a lot of the policemen call for repealing of the law, of lower thresholds for persecution, for maybe only 5 grams being allowed to be carried. So it remains a contentious topic, obviously. I mean, it is also being debated so by our politicians. But in my opinion, in my perspective, this is an experiment, and it's not going by without any losses, without any disputes, without any you see, when we were in the COVID pandemic, we all debated a lot. It was also some kind of experiment. This, obviously, the cannabis legalization is not as severe an experiment, but it is a massive change, and you have to consider that. You have to acknowledge that there are quite different opinions on this.
Thank you to all of you. I'll now move on to the questions from the audience. I have some more questions, and I'll come back to this final thought that Jakob mentioned about this being an experiment, and maybe we can talk about what kind of research and evaluations we need of this experiment and what's still missing. For now, I'll get to the questions. I have here one question from the audience that is about the kind of international influences and how much the international, or in the German case, being in the EU, kind of restricts what can be done. And then the question is, at what point, or how likely is it that for states to push for changes to the international drug conventions, which for the audience prohibit the non-medical, non-experimental commercial distribution of cannabis as one of the listed substances. Anyone wants to jump in on international conventions and constraints?
Yeah, I'll start. So obviously, conventions are there to be followed. I mean, otherwise we wouldn't need those, and we wouldn't try to discuss things like climate change internationally. Then still, Uruguay demonstrated that there are exceptions to international conventions, I guess, and Canada also kind of moved in their own way. Germany is an interesting example because it is not only following global international laws or conventions, treaties, but it also is embedded in the EU framework, as you've mentioned, and being located by, I think, circumcised, or what is it, surrounded by 14 neighboring states with thousands of kilometers of land border. And an open market, open borders. It's not as easy to change your drug policy so drastically as, for example, Malta did, an island, also European Union, but an island without any really direct neighbors. So obviously, Germany has to kind of see where their neighbor stands in terms of drug policy. They cannot just introduce a retail market like Canada and hope that all the neighbors just cheerfully agree on that. I doubt that this is a good option. So this is also why I think the first idea of the former Minister of Health to introduce a commercial retail market in Germany has been put down, has been revoked, and has been replaced by the current model. I think it's a very good idea to not follow up on a commercial retail market without having all the neighboring countries on board, really. But that's a very German or European, Central European perspective. Of course, the UK might act differently. It's still in Europe, but it's an island and doesn't have the same situation with the European Union and such. But yeah, I think maybe this is a good starting point to connect with your.
Yeah, if anyone wants to add on that, I can just quickly say that even though there has been kind of more, let's say, toleration of national experiments with cannabis, there is really on the international level very little appetite of opening up the international conventions, right? Because even though there have been some developments regarding cannabis, there's still a lot of very varying and differing opinions and positions around the globe. And we still have a lot of countries that are a lot more hardline regarding drugs and even regarding cannabis. So there is not really the discussion about reforms. In some countries, there's still the death penalty for possession, right? So it's going to be any kind of change to the conventions are highly unlikely and very difficult because of the difficult kind of geopolitical constellation around those. If you want, we can move on. And this is a very specific question about the kind of coexistence of a medical and a recreational system, and what has been proposed in Germany with changes to the medical system, making it harder, the prescribing, the mail order, the kind of telemedicine. What, if any, other thoughts of the panel regarding these proposed changes? And this might be a very Germany-specific question, so maybe Jakob, you can start, and then we can broaden it out a bit of having both the kind of a very kind of closed recreational market and a more open medical market, or vice versa, how that works out in the different countries.
Could you also summarize those changes that are being proposed? So like what is happening to mail order, for example?
Yeah, I can maybe briefly start on that, but I'd also be really interested to hear about your experiences, how the both markets coexist in the different countries. That would be really interesting. So as I've outlined, in Germany now it's a very, very simple way. There you can get it prescribed via telemedicine and get it shipped. And both options will, according to the draft of the new bill, will not be allowed in the future. So you have to see a doctor personally first, at least once every 12 months, and then you need to get it from your pharmacy locally. So you cannot get it shipped. My view on that is I think it's a reasonable approach. I can see the idea behind it, because there has been, or there's a suspected misuse of the medical system, although we don't really know the extent of the misuse. Obviously it's there, but it's one way to address it. I have two thoughts on this. First is, I doubt the industry will let it pass like that and just close their business model. They will find other loopholes. When I was thinking about Canada before 2018, you had these dispensaries where you would just go in, see a doctor, call a doctor, get a prescription, and then get your be in the dispensary basically and get your medication there. This kind of model would probably also work after the new restriction. So they will find their model. They will find their way to make money, and it'll work in some way or the other. The other thought that I had is my main concern about the medical market is that it's so unregulated and no one really is doing much about also the obvious illegal practices on it. So there needs to be more prosecution on that side, and there needs to be regulation in terms of the type of products allowed and the amount of THC. I don't think there's any good medical reason for medical cannabis to contain 25, 30% or whatever amount of THC. I don't think it's necessary. For those who really need high doses, they can get the the preparations, the sprays and or the pills or whatever, but the flower really doesn't need to have that high amount of THC. So I think this would be a much more effective regulation. But yeah, that's a very German thing now. So we don't really need to discuss this any further, I guess.
I can speak a bit with the dual markets, let's say, in Canada. So before legalization in Canada, and my memory on this might be a bit rusty, so happy for anyone to call me out if it's different. But before 2018, there was access to medical cannabis, and you could get that through various ways, which was growing your own and also being shipped to you. So it would be online. The physical stores that you saw were in the grey area. So they were not the legitimate ways to get the medical cannabis prescribed from your doctor. There was lots of them, and primarily in cities, and it was, I guess, confusing to people who have been there because they looked very legit when you walked in. They asked for your ID, you went through the system, etc. But they were in that grey area. So that's how it was pre-legalization. But after the Cannabis Act in Canada in 2018, that usurped the medical cannabis access. So you can everyone gets access to cannabis in the same way because it took over, or I guess brought the medical cannabis laws within the Cannabis Act. So it's all together. I think you can still talk to your health professional about medical cannabis. And again, I'd have to double check, but I think the home cultivation limit is different for if it's medical and if it's recreational. But other than that, it's within the Cannabis Act. So there was more of a difference, let's say, pre-legalization than post.
And are costs covered by Health Canada if you're a medical patient, a medical cannabis patient?
Ooh. There was a discussion about tax at the start, but that is not in my memory right now. So yeah, I'm not sure, but I think there was certain difference, or there was a discussion and debate about it. But while we're speaking, I can have a little Google while we're talking.
Yeah, I'm not sure in Canada. I know that in some US states that's the case, right? They're differently taxed.
Yeah.
Rosario, this is interesting because Uruguay, I think, is the one exception where medical cannabis did not precede recreational cannabis. So how do the two kind of come into being together and exist today?
Yeah, I would say that is quite the contrary. No, there was no medicinal cannabis previous to the regulation of recreational cannabis, and actually, if there is one market that is bigger than the other one, is the recreational cannabis is bigger than the medicinal cannabis. The medicinal cannabis is very, very restricted, and this is a huge complaint from the people that are involved in for example, it's a complaint from patients, from physicians, from many people that are saying it's incredible how this medicinal cannabis market is so small in Uruguay. It was so hard to really give license to producers. The Minister of Public Health during the government that was in charge of implementing the regulation of medicinal cannabis was really very restricted. So nowadays you can only see a very few products that come from pharma, but from that are imported. They are not produced in Uruguay. And then we have very few license from products like creams or very particular stuff with very with almost non-THC, and then there is a huge gray market of products that are sold through internet, but are made by producers that really don't have a standardized procedure to produce those creams or tinctures or whatever they prepare. So actually it's a problem. I mean, the medicinal cannabis in Uruguay is something that is really underdeveloped, and it's a problem. Nobody really is dealing with it. Neither the government, neither activists are pushing effectively in order to make the regulation works better than it's working now.
And Simon, to bring you in, what has happened with medicinal cannabis in South Africa?
Well, on the one hand, it's interesting in that the medicinal uses of cannabis were used as a justification and continue to be used as a justification for the liberalization of cannabis laws and, the creation of markets and the like. But beyond private consumption, the debates are primarily focused around commercial licensing and how to undertake that process, because that's been quite a big issue in that, everyone from the president and downwards has identified cannabis as a potential economic contributor to development alike. And so, it's been punted, and there's been a lot of debate around how to create licensing and a licensing system that justifies external or allows for external parties to engage with our market, but equally doesn't prevent it from being engaged with by locals. Because, for instance, in Zimbabwe, they've tried to make a licensing system which costs 50,000 USD to get a license, which is just not accessible to the local population, typically, So our big debate is, how do we include local farmers in a global marketplace? But in terms of medicalization, I mean, there are many tinctures and potions and the like available on the shelves, but these are produced in an unregulated fashion and typically in the large gray area that exists between formal regulation and informal production. So they are pseudo legal at the moment, and the claims they make on the bottles are completely unconfirmed and the like. So I wouldn't call them legitimate medicine as such. But we've never had a debate in this country about telesales or cannabis to the door or prescription the like, because I think primarily, while the law will allow it now, I sense that the medical community is typically quite conservative when it comes to the dispensing of cannabis in any form, and as such, it's not really, I mean, the debate has been there, but it's never been a significant debate here.
Thank you. And I'll come back to some of the questions that I prepared. It was alluded to at different points. And this has been brought up by kind of let's say it's the more updated, non-moralistic argument about cannabis reforms, is this kind of big cannabis business that will form, that will push inexorably for loosening of rules and then lead to increases in cannabis consumption. What is kind of the role of industry or big cannabis in each of the countries we have been talking about? So we might start with Elle, because Canada is often seen as kind of the ground zero of big cannabis, because that's where cannabis companies can be listed on the stock exchange, because it remains illegal on the federal level in the US.
That's right. Yeah, and I was reading the legislative review recently. So this again is the evaluation of the Cannabis Act. Started 3 years and was released in 2024, and there was a lot of discussion around industry within it and its conflict with the overarching public health objective. So in contrast to the US, the Canadian rules are quite public health focused and they're quite restrictive. So with, for example, marketing and advertising, it's very restrictive with our packaging of cannabis products. They're more plain packaging-ish in that there's only one standard color, there's just a brand, there's the THC labeling, health warnings, etc. So they look quite bland and boring in contrast to some of the jazzier products that we see in the US. And there's been pushback with that they can't bring people over from the illegal market because it's not enticing enough. They can't advertise and get brand awareness, let's say. There's another piece with edibles. So in edibles, there's a limit of 10 milligrams per package within one package, and that's all that can be bought in edibles. It's also said there that we can't bring people over from the illegal market to the legal market because of these restrictions. So we're not getting folk from the illegal market that perhaps want higher THC. So that's also been I guess, a critique from the industry, and they want higher limits on THC. This again would go against that public health focus of trying to limit THC consumption and also, I guess, encourage more sensible dosing. There was another conflict with industry with regards to storefronts. So in Canada, you can't look inside a cannabis store, so it must be blocked up. So people walking down the street can't look in. So kids can't look in and see cannabis there. It was repealed in Alberta, citing the reason that it was increasing robberies because people couldn't see inside, and therefore it was easier to rob stores there. So there's been points of conflict, I guess, within the Cannabis Act and different regulations that are there to protect public health, but may also go against trying to maximize this, I guess, the industry and bringing people over from the illegal market. But there's always that balance, and I think we mentioned it earlier between, I think it was Rosario, you mentioned it, that balance between objectives of an act. How do we, I guess, go fully for public health while also bringing people over from the illegal market? So I'll finish by saying that with that legislative review, they've acknowledged what the industry have said, what the public health messaging and the reasons behind certain regulations are. Some of the recommendations that they have from this legislative review is to keep things as they are. An example here being edibles. They've recommended keeping the edibles at 10 milligrams, whereas there's been recommendations of see what we can do to give, I guess, the industry a little bit more wiggle room without sacrificing public health. But overall, I think there's hopefully lessons from, let's say tobacco, knowing that it's easier to start restrictive and then loosen up regulations than it is to have a loose regulation and then spend 70, 80 years trying to strengthen them again. So anyway, I'll leave it there.
Yeah, Rosario, maybe really briefly, if you want to, in Uruguay, there is very little money to be made because the state has such strong control, but has there been a push from industry to loosen up Uruguay's quite restrictive regulations?
Yeah, no, actually, I would say that there is no push because there is no firms, big firms behind that. There is not even, I mean, the companies that produce the cannabis that is sold at pharmacies, they have the price defined by the government. As I said, the strains defined by the government, and actually, it's almost it's very difficult for users to see from which brand you are acquiring the cannabis because the envelopes in which cannabis is sold at pharmacy are white, and they have as a different color in one line in some lines, and the color is the sign of the brand. So there is no even a brand. So actually, yeah, companies ask for branding, but the government thinking about that, and they might come with a branding with the name of the envelopes, but as in comparison with other jurisdictions, it's very small what they are really pushing for, no? And they are also pushing for defining differences in price, but the government is not paying attention for that. So I say that maybe there will be a change in some kind of branding to identify which is the producer of the particular cannabis, but there is not a huge deal on that. Yeah.
And this is like one of the kind of also distinctive features of Uruguay, right? That the more fiscal or monetary incentive wasn't really there for the government. They didn't do that to increase tax revenue. Simon, you mentioned that this is something that in South Africa there has been this right-based discourse, but is the kind of potential revenue generation a big motivator for political actors to get involved?
I think on the one hand, there is a political rhetoric to get involved. So, I mean, the presidency has a cannabis office, which has been purposefully designated to try and encourage the commercialization of cannabis products and farming and the like. But, the licensing system is so complex and marred with so many difficulties that commercial production has not really taken off, I think, in the way people hoped it would, or politicians hoped it would. And ironically, those few that have been taken off or taken over have primarily been undertaken by external firms or international firms. So Canadian firms, for instance, have come to South Africa to farm cannabis, which was not really the government's intention, in the sense that, they wanted it to be a locally driven and a locally beneficial process. So there's concern that, that this corporate capture is occurring, in which the only people that can really afford the licensing fees are international companies, and they come and they sort of, they grow the cannabis and they leave and they take all the value with them. So there is that concern. On the other hand, the big debate at the moment in South Africa is how to bring on board and how to incorporate rural traditional farmers of cannabis. So, our Swazi Gold, and I don't know if you've heard of these brands in Europe and the like, but, the cannabis has always primarily been grown in traditional rural areas by small scale rural farmers. And the question now is, how do you commercialize that process in a manner that allows for taxation and allows for regulation and allows for the incorporation of what was previously an illicit market into a licit economy? And I think that has been the place where I think there have been steps made, in the sense that, there have been efforts to do something about this in a manner that is both in line with human rights, but also allows for traditional rural farmers to be incorporated in a meaningful way into the economy. The big issue is around distribution at the moment. So production is one thing. The problem is that there have been steps made to produce cannabis legally by rural traditional farmers, but as soon as they export it by someone, then they get arrested and they get thrown in jail. So sort of catch-22 there. So that falls, the distribution arena falls within the auspices of our bigger debate around cannabis legalization and privacy and the use by individuals. And so the policing aspect once more raises its head and becomes a detriment to the further commercialization of cannabis crops in the country.
So as we're kind of coming to the end and we have 5 minutes left, I'll pose a question to each of you, which is kind of more towards a wish list maybe, and which is kind of this: what are the known unknowns, or what is the unknown knowns? What are the things that are still missing? You all research legal cannabis, you all research reforms. Where are we still lacking in knowledge? Where do we need more research to better understand what's going on with legal cannabis and its effects? Maybe Jakob, if you want to start.
Yeah, sure. So as a public health researcher that has spent most of his time on alcohol research and alcohol policy research, I'm most interested in affordability, so pricing and money that is actually spent, and how can we change behavior by raising or lowering prices, putting THC taxes and all of that. What are the effects of all these measures? We don't really know nothing or next to nothing about this domain. And the other thing that I'm really interested in is availability. So how does it impact on people's behavior, especially people's initial thought, decision to go and stop by, try out, experiment with cannabis when there's lots of shops in their neighborhood. So these are two aspects that I'm really interested in generally, but both of these aspects probably don't really matter so much in Germany with our current model. So what I'm really curious about in Germany is to what extent the uncommercial model of mainly really cultivation, this is private and collective cultivation. This is a very unique model that Germany tries out. It's very un-German because, I mean, Germany is a very capitalistic country. There's no doubt about that. But here it tries out a very different route. So I'm really interested in whether this model can actually displace the illegal market effectively in the long run. Obviously not in 1, 2, 3 years, but can we change people's behavior to really go and grow their own cannabis, or maybe get it from friends who grow their own cannabis? Is this really making a dent in the illegal market by 50, 60, 70, 80%? Let's see. This is what I'm really curious about.
So maybe Rosario and then Elle, and then
Yeah.
we finish with Sam.
I can add to Jacob's also last interest, because I think that we share it. In a way, I am also very interested in how you can bring illegal users to the legal market. No, we understand that this is not going to be necessarily that 100% of users buy at the legal market, but how can you increase the legal market and also understand why so many people still use the illegal market? And I think that there are many social inequalities in the way in which regulations work, especially in the Uruguayan case with a mandatory register, with so many demanding things for users that really, for example, for people from low socioeconomic level, really makes things difficult to really go to the legal market. So in a sense, I understand these regulations, these legalizations that start with cannabis as a possibility to undermine illegality and undermine crime related with illegal activities. And in a sense, I think that we need to understand better how those things operate and how maybe you can have a legal market that is not going to undermine gangs and narco traffic, because this is a most complicated thing. But if you really, in a way, if you are successful in bringing some people out of illegal activities, that's an accomplishment of legalization and understanding the incentives and motives of users to go from one market to the other one, I think is very important.
And I'm really, really sorry. Unfortunately, we're going to run out of time. I'll just plug Elle's research and the research of the International Cannabis Policy Study that looks in different countries on user behaviors and motivations. So if there is already some research and surveys done on this, and more will come out, I think also in Germany, if I'm not mistaken.
Yeah, Germany and then Switzerland as well.
So there is some research being done, more needs to be known, and I think especially learning from what is going on elsewhere in the world and comparative insight can help to inform these discussions that hopefully go then beyond calling it shit laws or purely crafted laws based on seemingly very little evidence. Thank you so much, Rosario, Simon, Elle, Jakob, all the people in the audience for having been with us. Please follow our work on drugs and other topics here at GIGA. And with that, I'll close this GIGA forum. Thank you, everyone.